Hello, and welcome to the Smart Injury Doctors Podcast, the injury market's top program for doctors, lawyers, and insurers who want to gain greater insight on how to improve patient recovery results and deliver better services in the U.S. injury market. Please welcome your host, Dr. Jeffrey Allen Kronk.
Hello, doctors. What I want to talk about today is day one in your injury clinic. In other words, patient's day one. Day one is the most important visit for that patient. It's the most important injury visit that the patient's going to have is day one. All right. Now, why? Why is day one so important? Because day one is going to set the tone for everything. Day one is going to set the impression that the patient has of your clinic. Day one is that person's first impression. When that patient walks in, are you organized? Are you streamlined? Are you organized as a group so everybody's aligned with exactly what's going on? Because in day one, there's a lot of things that are going to be happening in day one. In day one, first of all, it's going to be the patient's first initial contact with your clinic, your staff, your paperwork, your procedures, right? So you have to get all the paperwork done in day one. You have to get, when I say all the paperwork, you have to get all the forms filled out, everything that you want the patient to fill out that indicates what is the injury, what is the damage. Now, you also have to get all of the financial aspects organized and set up on day one. You want all the finance information. You want their insurance, what the insurance information is, who's the at-fault driver. Just take a look at insurance. Let's say that your patient is a patient in a car that they don't own, driven by another, and they don't own that car. So they borrowed a car. So the person who's driving the car borrowed a car, and your patient is a passenger in that car. So look at the amount of insurances. You have your patient's insurance. That potentially is also, that's going to cover this. Your patient's auto insurance is primary. The driver's auto insurance. The car owner's auto insurance. All of these are sources of payment for that patient's injury. So you're going to get all the insurance information, the at-fault party, driver, if there's an attorney, you're going to get all of that information on day one. You're going to get all the forms filled out, and then you're going to do what? You're going to do a consult. In that consult, you have to get all of the information. You have to take your time in the consult. The patient has to feel like they're completely duplicated, and they should be. Now, there's a lot in day one. If you get day one right, it allows you to really shortcut a lot of documentation issues. So in that consult, you want to get all the information about the injury. You want to get anything that there is to know about pre-existing conditions, whether they're active or dormant. You want to get if there was a gap in care, gap in getting to care, why? Were they actively trying to mitigate their own circumstances by self-medication, by icing, by stretching, by sleeping on a cervical pillow of some kind, by doing some massage? What were they doing in order to try to mitigate their own condition? You want to get that. If there's a gap in care and they're self-medicating, for example, they're doing active care. Active care failed. They're now showing up for passive care delivered by a doctor or by a clinic. And so all that has to be documented. And then you're going to let them know at that point that the most serious injuries that the person could have is obviously a fracture or a ligament injury. And since they've been to the emergency room or, you're not thinking with fracture at that point, then it becomes ligament injuries. Ligament injuries are the number one cause of pain and disability in the world today, and you want that patient to know in the consultation that that's what you specialize in. This is what your clinic is looking for, and you're about to do an examination procedure and a radiographic procedure that actually is going to help you to identify how injured you actually are. In the exam, you're going to do a great examination. You're going to test motor test for all the nerves. Okay, so you're gonna, when I say motor test, you're gonna do a motor challenge. You're gonna grade. Do I got a grade 4, grade 3 muscle problem? You're gonna do a pinwheel analysis to check the dermatomes, to check for sensitivity in known dermatologic patterns. right? That's your motor and sensory testing. You're going to do range of motion. You're going to do your palpation. You're going to palpate intersegmentally. You're going to look for inflammation intersegmentally, which indicates ligament condition. You're going to do your orthopedic testing. You're going to do your cranial nerve tests. You're going to do all of that, and then you're going to explain to the patient that they're now going to do a procedure where they're going to have stress X-rays, specialized X-rays that are going to be able to tell and help you to determine the severity and location of their ligament injury. If the patient can't bend forward or they can't bend backwards due to pain or inflammation, then of course you're not going to do possibly a normal series and save your stress series for when the patient can bend. You'll document that in your notes, and then you basically would do those views at another date. But the majority of patients, in my experience, can bend forward, they can bend backwards, and so you can get an accurate intersegmental motion study at that point. So you're going to be then either deciding what you're going to do treatment-wise. Some of you start treatment, some of you don't. You may give them icing instructions. You're going to do the various things that you do in your own clinic. Then you're going to give them information to read, to take home, to understand the ligament injury. When we say whiplash is a sprain-strain injury. Sprain-strain means strain is a muscle injury, strain is a ligament injury. The ligaments are the number one cause of pain and disability in the world today. They're the thing that puts the patient at most risk for long-term residual complaints. So you're going to give them information to read about that condition, to read that says, hey, here's how you test for it. Here's how you determine the severity and location. This is what makes your clinic unique. These injuries, if found, need to be treated quickly and with the right treatment. So you're going to start to educate the patient that this is significant. This is not an insignificant condition, but also that you're very, very good at treating it. All of that is going to be done in day one. Now, that's a lot of moving parts. And it would be really good for you and your clinic to actually role play, to run through that each step of the way. You as a doctor go through each step of the way of your own clinic. Go through walking through the door and having your receptionist greet you. Go through what's communicated about the finances. Now remember, finances, that communication starts when the patient calls in, not when they finally arrive. When they call in, they should be informed that they should bring their insurance information, all the insurance information, all the claim information that they have. So, you as a doctor should walk through your door. Every staff member should participate in this. Role play it. Get greeted. Good. Here's your forms. Good. What is your clipboard like? What are your pens like? What is your spacing on your forms like? When you sit down in your clinic, what do you see? Do you see any information about injury and what makes you unique as an injury care clinic? Do you see information about the significance of these? What do you actually see? All right. Go through getting routed to the consultation. Have your staff go through consultations with you so that basically they can know exactly what's going on. Go to the examination room. Put your staff through an exam. Show them what actually occurs so that they have reality on it. They know what's going on. When you basically say, look, we're going to route you in for X-rays, route your staff, show your staff each step of the way exactly what happens and why, so that they know what happens. Because here's the thing, doctors, your staff are in touch with your patients more than you are. They're talking to your patients more than you do. So they need to be trained on exactly what occurs. Everyone in your clinic, when you hand a patient something to read, there's not a person in your clinic that shouldn't read that. And you may want to read it once a month just to reiterate, here's what it is, here's what it is, here's what it is, here's why it's unique, right? This is not something that you should do just one time. A band does not practice once. And the time to actually practice is not when you're in the game. When the patients are there, you're in the game. Okay? When the basketball players are on the court, you're in the game. The game time is not practice time. Practice time is to make game time perfect. Game time is not where practice should occur. And for a lot of you, game time is where your practice occurs. And it simply shouldn't be, because the patients perceive it. If you want referrals, you want somebody to say, wow, this is stellar service. This is a stellar clinic. This is unbelievable. I feel so well handled. That doesn't come on the fly in the game. That comes practice before the game ever starts. And that's why staff training is so important. There's not a procedure that an injury patient should go through. I don't care if it's day 2, the consultation, if it's reexaminations, if it's MRI report findings, CRMA, computerized radiographic mensuration report findings, if it's, I don't care what it is. It should be practiced. That's why in the Smart Injury Doctors program, we have staff training and we have check sheets. We have specific check sheets of specific things that need to be covered. And everyone in your clinic should know what's occurring on each one of those visits. And it's something that you should train and train and train and train and train. So you become perfect. Because I'll tell you what, when a patient comes in, if they came to a music concert with somebody that had practiced for 10,000 hours, trust me, their feelings about what they experience are going to be significantly different than somebody who practiced for 10 hours. And I'm not saying you have to practice for 10,000 hours. I'm just using it as an analogy that people feel different when the competency of the group is really high. And the competency of the group will never go really high unless you practice. So day 1, really, really important. Don't minimize day 1. That can be a great source of referrals for you, and it can be a great source of aligning the patients so they have great compliance, they get great treatment results, and they feel like they've been well handled, so they really will refer a lot of people. It all starts with day 1. So day 1 is important. All right, like all these podcasts, short, sweet, and to the point. If you have a comment, put it down below, please. If you have things that you're struggling with in private practice today that have to do with injury work, there's things that you just struggle with that you wish were gone in your practice, put it down below. Tell me what the top 2 or 3 things are that you're struggling with, because that's the content that I'll make for future podcasts. Doctors, I really appreciate you taking the time and giving me your attention today. Have a great day, and I look forward to seeing you on the next podcast. Thank you.
You've been listening to the Smart Injury Doctors Podcast, the #1 audio production show for professionals in the U.S. injury market that want to deliver better injury services to the patients, clients, or insureds they serve. If you like what you heard today, please leave us a review and don't forget to join us on our next program.